And so that's where we're kind of coming up against greed, you know, overusing all of the planet's resources, and then just enough is a feast. Can we get to enough is a feast? I mean, that's kind of the concept. But I think the more we can help men and women understand that being vulnerable is actually strength. And
being patient pays off.
And kindness. And affection and forgiveness and gratitude and harmony and all of these things that in certain structures feel like weakness are actually really, really strong traits for healing. And I think men are wanting that now.
Mm-hmm. They need it.
They need it.
Whether
Absolutely.
they are able to see it or accept it and embrace it, I think is the question. Because as my 16-year-old daughter declared, that's a fragile masculine, Mom. Trait. Or there's the toxic masculine, but this dichotomy and the polarization, I think the divine feminine is the solution to that of we'll just wait patiently. We'll just keep waiting.
It goes back to balance, right? Energetic balance, the yin and the yang. You need both. Yeah. It's not one or the other. It's both. That's why we have men and women. We need both.
And then a race where both are inside, like the men and the binary, non-binary, that whole conversation. That's a whole other episode. But it's really this idea of loving yourself and becoming complete. Then it doesn't really matter where you fall on any kind of sexual gender spectrum. It's wholeness. And that is really true in the fertility space, because if you feel complete already and whole, then the baby can be a bonus to the life. And I see it in these patients who are all up in the not enoughness and the scarcity mindset of lack. And I won't be happy until baby comes, and that despondency.
Yeah.
So...
But it goes back to the process and being present. And what is the one thing that we have as human beings that happens every moment?
Presence,
the breath.
The breath.
So the one thing that yoga does that teaches people is in every single breath, you have a life cycle. On the inhale, you're born, and on the exhale, you die. And so if you can get through this moment, you can get through the next moment and the next moment. And the longer you stretch your breath, the more it relaxes the nervous system. You go from the sympathetic nervous system of racing to try to get ahead to get to the result, and you slow down and you get to the parasympathetic nervous system. And all of a sudden now the body can heal, right? So, but the one thing we have, and I did a TED Talk on stress, and it was all about how I actually used my breath to slow down so that I could go through this process. But also, it was during an episode that I did of ER. And I was worried because I was pregnant with my son. And I was worried because I was hyperventilating, because I was playing a woman who was in early labor. And I was on the gurney outside of the ER room.
How far into your pregnancy?
I was 7.5 months.
Oh.
So
okay.
I knew it was too early for him to come out, but I knew that my physiology, he wouldn't know the difference between pretend and real, because my body was responding to the stress that I was under, and I was breathing fast, I was crying, and I remember just holding my hands in front of my belly going, his name at the time was John, because we named him John Zachary Henry. Now he just goes by Zach. I said, John, this is called acting. I'll explain it to you later. I'm just going to surround you with a bunch of white light. Just know it's not time to come out. I'm safe. You're safe. Just hang on,
Just do this with me. We're doing this together.
We're doing this together. You're okay. And I remember Charlie Haid was directing, and he called action, and they wheeled me in on the gurney, and George Clooney, who was playing the pediatrician at the time, we had done the rehearsal and everything was fine. And he pulled out his stethoscope and he put his stethoscope on my belly. And all of a sudden, because of my stress, John went from one side of my abdomen to the other and just did a rolling turn. And George was so freaked out because he didn't realize I was pregnant. He thought I was just padded. And so he jumped backwards 10 feet and stopped the take and went, excuse my French, what the was that?
Oh my God.
Yeah, I know. And I went, a baby? And he said, you're pregnant? I said, yes. What did you think? He said, oh, I thought you were just wearing a pad. And from that moment on, just understanding that our bodies are controlled by our thoughts, our feelings, and our breath. And when you can work with fertility clients and say, you actually have more control than you know. Mm-hmm. What are you thinking? What are you feeling? And how are you breathing?
Mm-hmm. What's your best choice right now?
Exactly.
Oh, take a breath with consciousness, right? So did you have to do that scene over again?
Oh, many times.
Okay.
Yeah.
And so you just kept telling Zach, okay, look how fun this is. We're having fun.
Yeah. Yeah. And he went full term. He delivered, I think, 2 days after my due date, and he was healthy.
I have a similar story with my boy, Jack, who was formerly named John. Near that same era or that same week in the pregnancy, he turned breech. And I think it was because Mom was working like 14-hour days, treating the patients, dealing with his older sister, and I was teaching the seed program live. And so Jack said, like, he turned up here and I went to acupuncture, of course. And I knew what to do because I had helped so many other women, which is partially how I feel like I overcame infertility in the first place. But in terms of turning the breech, I knew that Jack needed some reassurance that I was okay.
Yeah.
Similarly.
Yeah.
So I got my acupuncture needles in, I breathed, and I talked to him and said, I am okay. And believe me, when you get here, you will get plenty of attention. You're not going to just fall by the wayside with respect to all these patients and your sister taking up all the love. It will work out. And then later that night, I had some different fetal movement and he turned back into position.
Amazing. Yeah.
Consciousness.
Physician, heal thyself, right? But that was what I felt. I felt like I have these tools. I have to find a way to heal myself. And if I can heal myself, maybe I can heal others.
Right. Yeah.
And I guess that's, it's that old adage, make your mess your message. You had issues. You went, I need knowledge. I know I need to find a way to treat myself. And now I can actually share my story with others. And that's powerful medicine.
I remember you had some kind of program or something that you were doing that was about sharing the stories. Can you remind me what that was? And did it take off? What happened with that?
It was part and parcel of the idea that if you destigmatize fertility and you share your story, then other women will know they're not alone. And so many women have, as we've talked about, so much shame around their bodies not functioning that they keep it to themselves. They don't want to tell anyone that they're trying to conceive or they're having difficulty. And when you share your story about infertility, it actually empowers others to share. And the whole purpose was to elevate the conversation and to destigmatize it. And it was successful. It was on my website. And it was part of the blogging that we would do. And, there's also an evolution in the work that we do. And so it got to the point where I realized, like you did when you were pregnant with Jack, that you were doing too much. I had so many focuses. I was, working on a series. I was getting married. I had my fertility workshops that I was doing. I was teaching. My two lead teachers, Deborah Anderson and Wendy Obstler, were really itching to have more kind of their voice in my work. I had been the pioneer.
I remember.
And I really wanted to empower them because it wasn't about me holding on. Because part of it is sometimes things come through you to then give to the world. And I thought, I can't hold them back. Let me empower them to then take my work and plus it. And so they started Soulful Conceptions and Living Leela, and they're still doing that work. Just this week, one of my colleagues came to me and said, I know you do this fertility work. What should I do? And I'm setting her up with Wendy to do a private and use the fertility balls, and so that she can start to have some tools to get to the next stage. So the work continues, whether I'm personally doing it or not. I know that there is a larger mission besides my own personality that needs to be acknowledged for this. It's to give and to empower others. So even though that didn't become like a global share your stories, it was part of the process that led Wendy and Deborah to doing their work in the world.
Sure.
And I love that. And I'm so blessed that they care enough about what I've established to continue to give me credit for being the pioneer that helped them find their voices